Most men over 60 have been told for years that sexual activity just fades away, that it becomes unnecessary or even harmful as you get older. But what if I told you that's completely wrong? In fact, there are powerful secrets about masturbation that most older men never hear, and they could make a real difference in your health, confidence, and vitality. In this video, I'll share 8 surprising facts about masturbation every man over 60 needs to know. We'll cover how it affects your prostate, your heart, your testosterone levels, your erections, and even your emotional health. You'll learn what frequency is safe, what techniques protect you from injury, and how emotional well-being connects to your sexual health. The first secret I reveal at the end of this video is the one most men never expect, but it may be the most important for your long-term health. Stay with me until the very end so you don't miss any of these critical insights. And while you're here, tell me where you're watching from by dropping your city in the comments. I read every one. Also, if you want more doctor-approved advice for aging well, please like this video and subscribe to Glowing Age. Your support helps me create more valuable lessons for you. Secret number 8, it's normal and beneficial after 60. You've been told that sexual desire fades with age, that after 60 you're supposed to quietly accept a decline in intimacy, function, and even personal pleasure. That idea is completely false. In fact, the truth is the opposite. Healthy sexual activity, including masturbation, remains not only normal but beneficial well into your later years. As a urologist, I have this conversation with my patients every week. Many men over 60 carry shame or confusion about whether it's appropriate to continue self-pleasure. Some worry it might harm their health. Others feel it's something they should have outgrown. What they don't realize is that masturbation can actually play a very positive role in maintaining both physical and emotional well-being. Let's start with the science. Studies published in respected journals like the Journal of Sexual Medicine and the American Journal of Geriatric Psychiatry have shown that sexual activity, including masturbation, triggers the release of key neurotransmitters such as dopamine, oxytocin, and endorphins. These chemicals promote relaxation, reduce anxiety, improve sleep quality, and elevate mood. In a stage of life where stressors can include loneliness, health changes, and personal loss, these benefits become even more significant. For many older men, masturbation serves as a private way to remain connected to their sexual identity, especially if they have lost a partner or are dealing with medical conditions that affect partnered intimacy. It allows for continued exploration of one's own body, helps maintain sensitivity, and preserves a sense of control over one's sexual health. Physiologically, regular sexual stimulation helps keep the sexual organs functioning. Erections require healthy blood flow and tissue elasticity. Without regular activity, these tissues can begin to stiffen and lose flexibility. This is similar to how muscles weaken without exercise. Regular erections, even through masturbation, help maintain penile health by encouraging blood circulation, oxygenation, and tissue maintenance. I recall a patient of mine, George, who came to see me at age 72. He'd been widowed for several years and had slowly withdrawn from any form of sexual activity, feeling that his age made it inappropriate. Over time, he began experiencing more frequent nighttime urination, weaker erections, and feelings of depression. After a thorough medical evaluation, I reassured George that resuming safe, private sexual activity was not only acceptable, but could help address some of these concerns. Within months of gradually reintegrating masturbation into his routine, George reported improved mood, better sleep, more confidence, and even slight improvement in urinary function. It's important to understand that masturbation doesn't place harmful strain on the heart or prostate when done in moderation. In fact, studies have suggested a potential protective effect against prostate issues when ejaculation occurs regularly. Harvard researchers found that men who ejaculated 21 or more times per month had a lower risk of developing prostate cancer compared to those who ejaculated less frequently. While this data doesn't prove causation, it strongly supports the safety and possible benefit of maintaining sexual activity at any age. Another critical point: masturbation allows older men to remain familiar with their bodies. Changes in sensitivity, erectile firmness, or ejaculation can be early indicators of underlying health conditions like diabetes, cardiovascular disease, or hormonal imbalances. Regular self-awareness provides an opportunity to detect and address these issues earlier. What I emphasize to my patients is this: masturbation after 60 is not a sign of immaturity or desperation. It is a private, natural, and often therapeutic part of aging well. As long as it's not interfering with daily life, relationships, or used to avoid dealing with emotional challenges, it remains a completely healthy practice. In short, you have full permission, both medically and emotionally, to continue enjoying your body as you age. It can improve your mental health, protect your physical function, and allow you to maintain a strong connection to your own sense of masculinity and vitality. Secret number 7, supports prostate health. One of the biggest health concerns I see in my patients over 60 is the prostate. An enlarged prostate, inflammation, or even prostate cancer can all have a serious impact on a man's quality of life. What many men don't realize is that regular ejaculation, including through masturbation, may actually help protect this small but vital gland. Your prostate produces much of the fluid that makes up semen. When you ejaculate, you help clear out that fluid and keep the ducts and tissues functioning properly. Without regular release, secretions can build up, and over time, this may contribute to inflammation or other issues. Several large studies have explored this connection. One of the most cited comes from Harvard University, where researchers followed over 30,000 men for almost 2 decades. They found that men who ejaculated more frequently, specifically 21 or more times per month, had a significantly lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times monthly. While more research is still needed to fully understand why, the evidence suggests that regular ejaculation may help flush out potential irritants or carcinogens from the prostate. Beyond cancer prevention, frequent ejaculation may also reduce the risk of developing prostatitis, which is inflammation of the prostate. Chronic prostatitis can lead to pelvic pain, urinary problems, and even sexual dysfunction. Regular sexual activity, including masturbation, helps keep the prostate active and functioning smoothly, reducing stagnation and minimizing inflammation. Let me share a patient example. Thomas, age 69, had been experiencing frequent urination, occasional pelvic discomfort, and anxiety about his prostate health. After careful evaluation and ruling out more serious conditions, we discussed lifestyle changes to help support his prostate naturally. One of my recommendations was maintaining regular ejaculation. Over time, combined with dietary improvements and moderate exercise, Thomas noticed significant improvements in his urinary symptoms, reduced discomfort, and greater peace of mind regarding his prostate health. Of course, masturbation alone isn't a cure-all. It should be part of a bigger picture that includes healthy eating, physical activity, weight control, and regular checkups. Foods rich in antioxidants like tomatoes, pomegranate, and green tea can further support prostate health. But regular ejaculation remains one of the simplest, most accessible ways to keep this important gland functioning properly. For many older men, guilt or misinformation has caused them to avoid or suppress this natural function. My message is simple. Masturbation, done in moderation, can be a valuable part of keeping your prostate healthy. The research supports it, and so does my daily experience as a urologist working with men just like you. When you take steps to protect your prostate, you're not just improving urinary function or reducing cancer risk. You're also safeguarding your sexual health, your comfort, and your confidence for the years ahead. Secret number 6, maintains erectile function. One of the biggest fears many men over 60 quietly carry is losing the ability to achieve and maintain an erection. It's something few want to talk about, but I can tell you as a urologist, this concern is extremely common. What's less commonly understood is that regular sexual activity, including masturbation, can actually help preserve erectile function as you age. Erections depend on healthy blood vessels, flexible tissues, and properly functioning nerves. Like any part of the body, these systems benefit from regular use. When a muscle isn't used regularly, it weakens and becomes stiff. The same principle applies to the penis. Without routine erections, certain tissues can begin to lose elasticity and flexibility, and blood vessels may not dilate as easily. Inside the penile tissue are small blood vessels and smooth muscle fibers that require regular oxygen-rich blood flow to remain healthy. When erections occur, they fill these tissues with blood, bringing oxygen and nutrients while keeping the tissue supple. If this process happens less frequently, the tissues can slowly undergo a process called fibrosis, where they stiffen and lose their ability to expand properly. In my clinical practice, I've seen this play out many times. One patient, Alan, age 65, had stopped sexual activity entirely after his wife passed away. Over the years, he noticed that achieving an erection became increasingly difficult, even when he wanted to be intimate again. After evaluating his overall health, I recommended that he reintroduce regular, safe sexual stimulation, including masturbation, as part of his routine. Over time, Alan experienced gradual improvement in his erections, along with greater confidence and reduced anxiety around sexual activity. Scientific studies have supported this approach. Research published in the Journal of Sexual Medicine and other peer-reviewed journals has shown that regular sexual activity helps maintain erectile function, especially in older men. Frequent erections support healthy blood vessel function and help prevent the buildup of scar tissue within the penile chambers. It's important to understand that this isn't about forcing performance, but rather gently encouraging blood flow and tissue health. Even partial erections are beneficial for maintaining vascular and tissue flexibility. Masturbation provides a private, safe way to achieve this regular stimulation without the pressures or complications that sometimes accompany partnered intimacy, particularly in men who are widowed, divorced, or dealing with medical issues that affect their relationships. I often tell my patients that maintaining erectile function after 60 requires the same mindset as preserving muscle or joint health. You don't stop walking because your knees are aging. You walk carefully, regularly, and smartly to keep your joints functional. The same principle applies to sexual health. Masturbation, when practiced in moderation, gives your body the ongoing signals it needs to preserve erectile health, reduce the risk of tissue stiffening, and keep you feeling confident and capable well into your later years. Secret number 5, hormone balance support. When most men think about aging and sexual health, their first concern is usually testosterone. After 60, it's normal for testosterone levels to decline gradually, but what many don't realize is that certain daily habits can influence this process. One of these habits is regular sexual activity, including masturbation. Testosterone is a key hormone that supports energy, mood, muscle strength, bone density, and sexual desire. Declining testosterone can lead to fatigue, low libido, weaker erections, and even changes in mood or confidence. While medical therapies exist, not every man needs prescription interventions. Lifestyle factors often play a powerful role in stabilizing hormone levels. Multiple studies have found that sexual activity itself can support healthier testosterone balance. One study published in the journal Psychoneuroendocrinology observed that men who engaged in regular sexual activity had higher levels of circulating testosterone compared to those who were sexually inactive. This isn't just about the physical act. It's also about maintaining sexual arousal, stimulation, and a healthy psychological connection to one's sexuality. Masturbation serves as a safe, controlled way to stimulate these hormonal responses. The process of sexual arousal and orgasm triggers complex hormonal cascades in the body. Dopamine and oxytocin are released, which help elevate mood and reduce anxiety. These hormones indirectly influence testosterone production by lowering cortisol, the body's primary stress hormone. High cortisol levels suppress testosterone, especially in older men. By reducing stress and promoting relaxation, regular sexual activity can help minimize cortisol's negative effects, supporting healthier testosterone levels. One patient of mine, Richard, age 70, came to my clinic complaining of low energy, reduced libido, and poor sleep. His lab results showed testosterone levels on the lower end of normal, but not low enough to require medication. Together, we worked on natural lifestyle adjustments, better sleep, moderate exercise, stress reduction, and regular sexual stimulation through masturbation. Over time, Richard reported feeling more energized, his libido improved, and his mood stabilized. His follow-up labs even showed a slight rise in testosterone levels. It's important to note that masturbation isn't a miracle solution for hormone health, but it plays a helpful role in a much larger picture. Consistent sexual activity supports the hormonal systems that regulate arousal, confidence, and overall vitality. In men over 60, maintaining hormonal balance is about managing multiple factors gently and consistently over time. Masturbation offers a private, natural way to engage these systems without medication, side effects, or risk when practiced in moderation. Ultimately, protecting your testosterone levels isn't just about numbers on a lab test. It's about maintaining your drive, energy, and quality of life as you age. Masturbation, when combined with other healthy habits, can quietly support these processes and help you feel like yourself longer into your senior years. Secret number 4, cardiovascular health impact. When we talk about sexual health, we are also talking about cardiovascular health. The two are deeply connected, especially for men over 60. As a urologist, I remind my patients that the strength of an erection depends almost entirely on the health of their blood vessels. What surprises many is that regular sexual activity, including masturbation, may actually help support a healthier cardiovascular system. During sexual arousal and orgasm, your heart rate increases, blood pressure rises temporarily, and blood vessels throughout your body dilate. This mild cardiovascular workout stimulates circulation, promotes flexibility in blood vessels, and helps maintain the smooth muscle function critical to both heart and sexual health. While masturbation doesn't replace formal exercise, studies have shown that regular sexual activity correlates with better vascular health. Research published in the American Journal of Cardiology and European Heart Journal has indicated that men who engage in regular sexual activity have a lower risk of cardiovascular events like heart attacks and strokes compared to men who are sexually inactive. One of my patients, Harold, 71, had controlled hypertension, but noticed his energy and sexual function were gradually declining. While we worked together on his diet, exercise, and medications, I also encouraged him to continue safe, regular sexual activity, even if that meant masturbation in the absence of a partner. Over time, Harold experienced improvements not only in his sexual confidence, but also in his blood pressure stability, energy levels, and emotional well-being. Another factor to consider is nitric oxide, a key molecule your body releases during sexual arousal. Nitric oxide relaxes blood vessel walls, allowing for improved circulation throughout the body. This process helps maintain the flexibility of arteries and smaller vessels, which is crucial for both erectile function and cardiovascular performance. Men over 60 often experience a gradual decline in endothelial function, the ability of blood vessels to dilate and contract efficiently. Regular erections, even achieved through masturbation, help stimulate nitric oxide production and keep these vascular pathways active. Additionally, the relaxation that follows orgasm has been shown to lower stress levels, which indirectly benefits cardiovascular health by reducing cortisol and minimizing strain on the heart over time. In my practice, I view masturbation as one part of a holistic approach to aging well. It's not a substitute for regular physical exercise, healthy eating, or medication when necessary, but it's a small, often overlooked habit that can gently support your cardiovascular system alongside these other pillars of good health. For men concerned about heart health and sexual performance, it's important to recognize how closely linked these systems are. Taking care of one often helps support the other. Masturbation, practiced in moderation and combined with healthy living, can serve as a private, natural way to keep your blood vessels flexible, your circulation active, and your heart supported well into your senior years. Secret number 3, watch frequency. The fine line. While masturbation offers many benefits for men over 60, like anything else, balance is essential. In my practice, I often tell patients that moderation is the key to making masturbation a healthy part of aging, rather than a source of potential problems. As men get older, the body's ability to recover from sexual activity changes. Unlike in younger years, frequent masturbation may sometimes lead to fatigue, temporary pelvic discomfort, or even a temporary drop in sensitivity if overdone. Understanding your body's limits and listening to its signals becomes more important with age. There isn't a universal number for how often is too often. Every man's optimal frequency is different and depends on his overall health, energy levels, hormonal balance, and personal comfort. For some, a few times per week feels right. For others, it may be less frequent. The key is paying attention to how you feel physically and emotionally afterward. I had one patient, Frank, age 68, who came to me concerned about pelvic discomfort and occasional soreness. After a thorough examination to rule out medical causes, we discussed his habits. Frank had increased his frequency to daily sessions, thinking it might help with his erections and mood. In his case, the high frequency was causing mild irritation to sensitive tissues and contributing to his symptoms. We adjusted his routine, reducing frequency and emphasizing proper lubrication and gentle technique. Within weeks, his discomfort resolved and his sexual function remained stable. Excessive frequency can sometimes lead to desensitization. This occurs when overstimulation reduces the sensitivity of nerve endings temporarily. Some men may find that it takes longer to achieve orgasm or that their erections feel less firm after frequent daily sessions. Allowing adequate recovery time between sessions can help prevent this issue and maintain sensitivity. From a hormonal perspective, very frequent ejaculation can lead to transient shifts in hormones like prolactin, which may temporarily suppress libido or energy if not balanced properly. Again, this isn't dangerous, but it emphasizes the importance of moderation. The psychological component is also important. If masturbation becomes a coping mechanism for stress, loneliness, or boredom, rather than a healthy form of sexual expression, it may signal the need for emotional support or counseling. Healthy masturbation is about pleasure, connection to one's body, and well-being, not avoidance or escape. I always advise my patients, if masturbation is leaving you feeling satisfied, energized, and content, you're likely in a healthy range. If you notice fatigue, soreness, frustration, or emotional distress, it may be time to adjust your frequency and routine. The goal is sustainability. You want sexual activity, whether solo or partnered, to support your long-term health, confidence, and enjoyment. By listening to your body, practicing moderation, and seeking medical advice when needed, masturbation can remain a positive and safe part of your life after 60. Secret number 2, safe techniques matter. One of the most overlooked aspects of masturbation, especially as men age, is the importance of technique. At 60 and beyond, the body changes in ways that make safety even more important. As a urologist, I see many older men dealing with preventable issues simply because they never adjusted their habits to match their changing bodies. As skin ages, it becomes thinner, drier, and more fragile. This makes the tissues of the penis more vulnerable to irritation, microtears, and soreness if masturbation is performed too aggressively or without proper lubrication. Using adequate lubrication is one of the simplest yet most effective ways to protect the skin and maintain comfort. Water-based or silicone-based lubricants are both safe options, depending on personal preference. Avoid using soaps or lotions not designed for sensitive skin, as these can cause irritation or allergic reactions. I recall one patient, Dennis, age 72, who came to me complaining of redness and sensitivity that lingered after sexual activity. After ruling out infections or other medical causes, we discovered he had been masturbating without any lubrication, often using a rough grip. Simply changing his routine by using a quality lubricant and adopting a gentler technique resolved his symptoms entirely. Technique also plays a role in preventing more serious conditions like Peyronie's disease. This condition occurs when scar tissue builds up inside the penis, often as a result of repeated minor trauma or bending injuries during erections. Over time, it can lead to curvature, pain, and difficulties with erections. While paronies can develop for various reasons, aggressive or forceful masturbation increases the risk, especially when performed without proper care. Another group that needs to be particularly cautious are men with diabetes or those taking blood thinners. In diabetic patients, reduced sensation, neuropathy, can make it harder to recognize when too much pressure is being applied, increasing the risk of tissue damage. Blood thinners, on the other hand, can make bruising or bleeding more likely if tissues are injured. It's also important to avoid using objects or devices not designed for sexual activity. Improvised tools can cause unintended injuries, infections, or damage that may require medical attention. The key message I give my patients is simple: be gentle, be mindful, and respect your body's limits. Slow, controlled movements with adequate lubrication help maintain both comfort and long-term penile health. Masturbation should leave you feeling relaxed and satisfied, not sore or injured. If any unusual symptoms develop, such as persistent pain, lumps, unusual curvature, or changes in erectile function, it's important to seek medical evaluation early. Many problems can be treated successfully when caught early, but delaying care can allow minor issues to become more serious. By practicing safe techniques, you protect not only your immediate comfort, but also your long-term sexual health. As your body changes, your habits should adjust with it. This attention to safety allows masturbation to remain a healthy, pleasurable part of your life well into your later years. Secret number 1, emotional health connection. As we reach the most important secret, I want to focus on something that often gets overlooked when discussing masturbation: your emotional health. For men over 60, the way you approach sexual activity, including masturbation, can have a powerful connection to your mental and emotional well-being. Many older men face emotional challenges that come with aging: loneliness, the loss of a spouse, changes in physical ability, or even shifting identity after retirement. Masturbation can serve as a healthy way to stay connected to one's sexuality, confidence, and sense of manhood. But like any behavior, the emotional reasons behind it matter just as much as the physical act itself. In my practice, I've seen two very different patterns. For some men, masturbation is a source of relaxation, comfort, and reassurance. It helps them feel alive, reduces anxiety, and maintains confidence. For others, it can quietly become a way to escape deeper feelings of loneliness, grief, or emotional pain. When masturbation becomes a substitute for addressing emotional struggles, it can slowly contribute to feelings of emptiness rather than healing. One patient, Martin, 74, came to me not because of any physical issue, but because he felt emotionally distant from himself. After losing his wife, he began relying heavily on masturbation as his only form of intimacy. Over time, he noticed it no longer brought him the same comfort and instead left him feeling more isolated. We worked together, addressing his grief directly, encouraging social support, counseling, and healthy activities. As he rebuilt emotional connections in his life, his relationship with sexual activity naturally became more balanced and fulfilling again. Masturbation should never feel like an obligation or a way to avoid dealing with emotions. Instead, it should be part of a broader picture of emotional and physical self-care. When used as a healthy expression of sexuality, it supports confidence, stability, and a positive self-image. For men who are partnered, open communication with your spouse or companion about intimacy is also crucial. Sometimes, men withdraw sexually due to embarrassment or fear of performance issues. Masturbation can remain part of a healthy relationship when approached openly and honestly, without shame or secrecy. Another important point: emotional well-being directly affects sexual performance. Depression, anxiety, and chronic stress can all contribute to erectile dysfunction, lowered libido, and difficulty achieving orgasm. By maintaining emotional balance through healthy relationships, stress management, hobbies, and personal growth, you naturally support your sexual health as well. I always remind my patients that sexual health is not just physical. It's deeply tied to your state of mind, your relationships, and your overall sense of purpose. Masturbation, when approached with emotional awareness, can serve as a safe and natural part of emotional healing and self-care, rather than an escape from the real challenges that life may bring. In short, take care of your emotional health as seriously as you take care of your physical body. When both are in balance, your sexual vitality can remain strong and meaningful well into your later years. Now you know the 8 secrets about masturbation that most older men wish they had learned sooner. When done safely, in moderation, and with awareness, it can support your prostate, your circulation, your hormones, your erections, and even your emotional health. Small habits, when done consistently, can protect your body and your confidence as you age. If you found these insights helpful, please take a moment to like this video and subscribe to Glowing Age. Your support allows me to continue bringing you clear, science-based guidance to help you thrive after 60.